Thank you again so much for the opportunity to be here this morning. A special thank you to the Press Club and especially Ryan for the invitation. It is always exciting to be among a group of individuals who understand policy and understand the issues that we're facing in our state. As Ryan mentioned, I am the Director of Health Policy and Governmental Affairs with the Louisiana Primary Care Association. And I'm going to talk with you all this morning, not only about the work that we do as FQHCs, some of our coalition work, and the work that we've been doing around Medicaid cuts. If you watched the news this morning, it was the first thing that was on the news, talking about what they did over this weekend in Congress related to the Big Beautiful Bill. We have serious concerns about not only the impact on patients in our community health centers, but the impacts in our state. So just to tell you a little bit about what we do and what exactly is an FQHC. Many people hear the acronym and they're like, what is that? I know I've heard it, I know I've seen it places, I know I hear it on the news, but what exactly is an FQHC? FQHCs are federally qualified health centers and also known as community health centers. They are nonprofit healthcare providers that serve low-income and medically underserved populations. They offer primary care services and other services regardless of a patient's ability to pay, often using a sliding fee scale. Some of the characteristics of FQHCs, also known as community health centers, as I mentioned, that they are nonprofit organizations. One of the most important things that we like to highlight about an FQHC is they are governed by a board that is 51% of patients who receive care in those community health centers. So each FQHC board is made up of 51% of individuals who are actually patients. That is extremely important to the work that they do because that allows patients to have an opportunity to have input in the governing body and interest into what that is that they receive in their health centers. FQHCs focus on serving individuals who have limited access to health care, including those with low income, those who are uninsured and underinsured. And of course, we use all of these words, but what exactly do those words mean? In a state like Louisiana, we have individuals who do not have access to health care, whether it is a health care community is not close to them, or they don't have access to Medicaid or health insurance. And so when we talk about an underserved area, we may be talking about an area within our state that the nearest FQHC is 15 miles, but there's no public transportation, or the nearest hospital is 50 miles. That happens across our state in many, many communities, and those communities will be largely impacted by Medicaid cuts. As Ryan mentioned in the introduction, last year, FQHC saw over 503,000 patients. Those patients, in turn, had about 710,000 visits in our health centers and 75,000 virtual visits. What were some of those visits? We saw patients for medical visits, dental, behavioral health, and substance use. Just a little bit more about the type of care that you can receive in an FQHC, which is important to know within Medicaid cuts because also mentioned 60% of our patients are Medicaid patients. So if Medicaid goes away for our state in any numbers, then we will have large numbers of patients who are not receiving the care that they need. FQHCs provide preventive care, primary care, behavioral health, dental, pediatrics, school-based health, telehealth services, health education, in-clinic pharmacies. We call that our in-house pharmacies. So you can go and have your health center visit with your provider and then obtain your prescription before you leave your health center. We provide screenings for blood pressure, diabetes, cancer, mental health, and other chronic illness management in clinic and through remote patient monitoring. We have health centers that provide OBGYN services, medication-assisted substance use disorder, podiatry, smoking cessation, and treatment. That is just our short list of services that we provide in our health centers. So why was it so important for me to mention that data? As stated, and I'll repeat it several times because it's such an important number, Of that 503,000 patients that I mentioned, 60% of them are Medicaid patients. So Medicaid is a huge source of funding for our community health centers. Important to note that Medicaid reimbursements allows our FQHCs to provide that care that I mentioned for those underserved populations, including low-income families and children. The FQHC community model is a unique model. It is a model that I love to talk about within these forums because many individuals don't realize that our FQHC model requires us to reinvest any savings that we have back into the health centers and back into the communities. So many of our health centers use those cost savings to offer transportation to patients. We have health centers that have daycare facilities within the health center. We have health centers that are using their in-house pharmacies to also deliver medication to patients and offer remote patient monitoring. So we reinvest any of those Medicaid savings back into our communities. So I've talked about Medicaid, I've talked about the 60% of our patients, but what exactly is Medicaid? We hear that a lot. We hear Medicaid, we hear Medicare, we hear uninsured and underinsured. And just so we're all on the same page, what is Medicaid? And why are we hearing it on the news every day? Because Medicaid is a federal program. Of course, states receive that federal money, and states have their own Medicaid program that they are allowed to create some of their own rules and regulations. But Medicaid is a federally funded program. And right now we're hearing about $900+ billion in cuts to the federal Medicaid program. And that is going to be across our country, across Louisiana, will be impacted by those cuts. So Medicaid covers medical costs for people with limited income and resources. Many people do not realize that nursing home patients are Medicaid patients. We think about Medicare because Medicare is the government program for our elderly population. But in a state like Louisiana, I've read data that has said 1 in 2 nursing home patients, 1 in 3 nursing home patients are Medicaid patients. And so when we're talking about Medicaid cuts, we're not just talking about health center patients. Of course, at the LPCA, that would be our concern because that's the work that we do. But we're talking about Medicaid cuts across our state that would impact children, adults, families, nursing home patients across the board. Medicaid gives health insurance coverage to pregnant women who would not otherwise have health insurance, and 1/3 of the Louisiana population. So we have 60% of our health center patients on Medicaid, but 1/3 of the Louisiana population. So I'm just going to pause and let that sit for a moment. That means that everyone in this room knows someone that's on Medicaid. That could be your neighbor, someone in your family, someone at your church, someone on your job, someone you met just today, someone you'll meet tomorrow. 1/3 of Louisiana's population are Medicaid patients. Another important data piece is Louisiana ranks second as a state that is most dependent upon Medicaid dollars. The only state that receives more Medicaid dollars that are more dependent is New Mexico. So Louisiana ranks second. So when we think about $900 billion cuts to the Medicaid program, and we think about Louisiana being a state that is highly dependent on Medicaid dollars, that also will impact our state budget. So not just our health system, but our state budget as a whole. Louisiana is a Medicaid expansion state. So that means that we receive extra money for our Medicaid expansion. Right now, the federal match for Medicaid for our state is about 60-something%, 67% or so that we get from the federal government, and then Louisiana invests the other 30-something. For our Medicaid expansion population, the federal government matches at 90%, and the state matches at 10%. So if we lose that money, where is it going to come from? The state budget is not going to be able to handle that deficit. and Louisiana residents will lose their Medicaid. And not only will they lose their Medicaid, but the unfortunate that we don't talk enough about is Louisiana residents will die. That is a harsh reality. We will have individuals who will be misdiagnosed for health issues, undiagnosed for health issues, will not be able to get to the doctor because their clinic will have closed, their primary provider will no longer be in the area, and the nearest hospital will be 50 miles away, or that rural hospital may also actually close because of cuts to Medicaid. So we're looking at a state where not only our general budget will be impacted, our healthcare budget and our healthcare costs, as well as our ability to care for our Louisiana residents. So why are we so concerned about the big, beautiful bill? I won't ask you to raise your hand, but if you watched the news this morning, it was the first thing that came up at 4:30 when I was watching the news. And they were talking about what Congress did over the weekend. Depends upon your news source how they actually broke it down, but the numbers are pretty much the same. We're looking at billions of dollars, hundreds of billions of dollars of cuts. And the reason why we are concerned, right now the numbers is saying that about 200,000+ Louisiana residents will lose their Medicaid coverage. So when we think about 200,000 residents in a state that is already an unhealthy state, we're looking at health issues beginning to be worse and people having nowhere to go. Again, thinking about your neighbor, thinking about people that you care about, thinking about your family. Every part of our state will have dire consequences from an unbalanced budget. In Louisiana, with the federal government match, there would just be no way to make up that revenue, no way to make up that additional funds. Our Louisiana legislature started some of that conversation, and we've also heard that there may have to be a special session to address some of these issues about what's going to happen with our Louisiana budget. So what are our community health centers preparing for with this cut? I want to note that $964 million is the cost savings to Louisiana that our health centers have because of the services that we offer. And so when we think about cost savings, when a patient is seen in a federally qualified health center, it is saving the state money because that patient is not having to go to the emergency room, not having to go to the hospital, because they are receiving the care that they need in a community health center. National data has said that community health centers cost 23 to 27% less than an emergency room visit. And that care that a patient will go into an emergency room, which would happen if they don't have Medicaid. We know that when people don't have health insurance, they wait until their health issues get worse out of fear that they cannot afford to go to the doctor. They end up in the emergency room, and those costs are tripled for the care that they receive in the emergency room. We all know that preventive care is always cheaper than a hospitalization. And so when we're looking at those budget cuts and that individual is not able to go to their doctor, they end up in the emergency room, and they end up being diagnosed later for something that could have been prevented or could have been cared for sooner. Community health centers delivers results through the effective management of primary care and chronic diseases and keep patients out of the emergency room. On average, again, that savings amount, that dollar amount is $2,371 in total spending per Medicaid patient, which is about 27% lower than that patient going to the hospital. Cuts in Medicaid funding would be very harmful to our community health centers, to hospitals, and across the state. At a very top level, some of our clinics will close, rural hospitals will close, and individuals will lose their access. So at the highest level, hospitals will close, clinics will close, and people will die. That is something that I just cannot imagine that we will be facing in our state today, but it is an unfortunate reality. Like many other small businesses, community health centers are mindful of our incomes, but it is very difficult to plan ahead, especially when every day this bill changes and it actually gets worse. And depends upon what your health policy issue is. There are some things that may seem a little better, but there are things that are getting worse. And we don't know the final outcome. Things could be changing right now while we're in this room, because it's still in that congressional process. So for our community health centers, we are resilient, we're innovative, and we want to make sure that our patients have care. What we would like for you all to know about community health centers is that we have some of the best providers in the state, and we care about our patients. We also want you all to know, talking about work requirements. Again, just kind of nod your head if you've heard about work requirements. At best, work requirements are not bad, at best. But it's not just about individuals having a job. Medicaid patients at large are working individuals. It is untrue that most Medicaid patients do not have jobs. At large, Medicaid patients are working individuals. The issue with work requirements is the red tape. The issue with work requirements in a state like Louisiana could also be access to the internet. You are requiring individuals to recertify via the internet, but they live in a rural area and they don't have access to the internet. Or you're requiring an individual to come in for an appointment to recertify, but they don't have transportation, or they're working a job that they don't have paid leave, and so they're unable to take off from work. And so for work requirements, of course, able-bodied individuals are working. As health policy individuals, we want able-bodied individuals to have jobs. We know that having a job not only contributes to your ability to take care of your family, but that impacts your mental health in a positive way, that impacts your behavioral health in a positive way. So of course we want individuals to be working. But work requirements is just another barrier because of the paperwork, not because individuals are not working and are not maintaining employment. I know if someone asked me in the middle of the day to log on and sit at my computer for 2 hours and fill out some medical paperwork, I would probably have a barrier. Not that I don't have the internet, not that I cannot understand what I'm reading, but who has the time in their day to stop and complete paperwork, especially when we're looking at work requirements and all of these recertifications being repeatedly, 2 and 3 months, over and over, having to complete paperwork. That is a barrier. It does not, nowhere in any data in any state has it proven that work requirements improve health outcomes. Medicaid should be about health outcomes. And if we're implementing policies that do not improve health, then we need to look at that policy and the benefit of that policy. Just some additional numbers, 63% of adults on Medicaid are working. 63% are working. The other 32+% are taking care of their families or they're in school. So again, people do have jobs while they're on Medicaid. And if they're not working, they're in school, advancing their life so that when they get another job, they may not have to rely on Medicaid for their services. What do we want you all to know? Well, first, before I conclude, I do want to acknowledge if you heard anything about SCR 32. So Senate Concurrent Resolution 32 is a resolution that our Louisiana legislature passed overwhelmingly, bipartisan support, memorializing Congress to not make cuts to Medicaid. So in our state, while we're looking at Medicaid cuts, our Louisiana legislature passed a resolution that said, please do not cut Medicaid. Our state cannot afford it. Our Louisiana residents need it to maintain their health. And it was a coalition of us that got together and were like, hey, we need to do something about this. And we found a bill sponsor in Senator McMath and Representative Baralt. And I want to acknowledge that some of those coalition members are here in the audience today. We have Charmaine with United Way. We have Alice with American Cancer Action Network. and Sarah Jane, who is actually working with one of our community health centers, Crescent Care in New Orleans. We have the budget project representative, well, Invest Louisiana now. And then we have 2 staff members from the LPCA, Tara and Abigail. Thank you all for being here. Just in summary, our state cannot afford to make up any deficits for Medicaid. Health centers will close in our most rural areas. Hospitals will potentially close, or health centers will have to reduce the services that they provide. What we are asking you all to do here today, please contact your legislators in Congress and in this state and encourage them to think about Louisiana, think about the patients here, think about our residents, think about the care that we need when they're making decisions and debating policy in DC and in Louisiana. Thank you all so much for your time. I think I'm supposed to pause for questions. Yes, sir. Yes, absolutely. So Medicaid expansion is one of the biggest proponents that came out of the Affordable Care Act. And so the work requirements that are being proposed in the big, beautiful bill are actually targeted at those individuals who receive Medicaid expansion. And so when we think about Medicaid expansion through the Affordable Care Act and work requirements, those individuals will be the most impacted by that paperwork and the red tape to be able to maintain their Medicaid. And so Medicaid, the ACA, the Affordable Care Act, is a part of the overall Medicaid program, but not all states implemented Medicaid expansion. Louisiana is one of those states. So there are proponents of the Affordable Care Act where individuals are purchasing through our health information, through the health, I can't think of the website right now, marketplace, thank you. Through the health marketplace, individuals are purchasing their own insurance, but it's a subsidy of the Affordable Care Act because they're not actually paying the full amount for the health insurance. They're getting a portion paid through the Affordable Care Act. Yes, sir.
How big is the form for work requirements? You said it's 2 hours to fill out. Is it really that long a form?
It's asking you for a lot of information. I have not completed the form myself, let me say that, but I have heard individuals in their story because we've collected some patient stories from Medicaid. The American Cancer Action Network is doing an amazing job in leading that cause and collecting patient stories. And patients talk about the site crashes all the time, and so they have to start over. They're having to upload information, take pictures, upload the information, and then when they're done, it crashes, so they have to start over. So with all of those issues with technology, then that can create the cumbersome paperwork for individuals who are having to complete it. So we have had individuals to say 2 hours to do their work requirements. We've had individuals to say that it took them weeks to be able to complete the process because of technology differences, because of them asking for additional information.
Such an important document, it would seem it could be available at the post office, if it's not too many pages, 2 or 3 pages, and then just simply put a stamp on it and you're done.
There's certainly different things that we've thought about that could make it easier. I know that during our past legislative session in Louisiana, there was another bill, Senate Bill 130, that talked about work requirements for our state, certification requirements for our state. And right now, Louisiana has said that they don't really have a lot of the technology to be able to make these certification requirements happen. And so we're looking at another millions of dollars for Louisiana's system to be able to brought up to par for this technology to work, for work requirements to be certified. Yes, sir.
Now that we are in hurricane, and we have the hospital system, and the reimbursement system that we have, and we have the payment that's accepted, and we have the vacation. Do you believe any tropical storm development, Gulf of Mexico or the Gulf of America, that would have problems that would really cause us to worry because of how things are right now as a result of the things that you brought out yesterday?
So I think there's a tropical storm out there now. Let me say that. I think I woke up to that news this morning as well. And so, I mean, we can talk about Louisiana historically. When a hurricane hits us, it's usually the big ones. And so, if I understand your question correctly, I know that we've had individuals to fall within evacuations for hurricanes and not being in their city, not being near their physician, and then having to re-enroll in Medicaid and all of those things and being caught up and losing their access to their health care. I know that we have talked about in our state having processes that if there is a declaration of emergency, then a lot of these requirements go away. But how long does that keep a patient maintained? What happens when the state of emergency ends? I think that those are all access issues that we'll be looking at as a state.
So you're going to end those legislators that sign on to that request that talk about this kind of thing working, with these various industries. Should that happen?
I don't know if they thought about that. Let me say it that way. I can't speak to whether they thought about it, but I can speak to the fact that our coalition has met with every member of our congressional delegation and talked with them about our concerns for Medicaid cuts. We've had in-person meetings with our congressional delegation. We've had virtual meetings. We've sent out action alerts. We have sign-on letters. So I can speak to the fact that we've communicated those concerns. Thank you. Yes, sir.
Federal government sends the Medicaid funds to Louisiana, and then Louisiana is responsible to certify who can get money and who cannot get money.
Yes.
And so Louisiana is responsible for the form that is required in order to be certified.
Yes.
Is that a federal form or a state form that was made by the state of Louisiana?
So the federal government gives every state their Medicaid match based upon the Medicaid, based upon the federal formula per capita. Then the states create their own policies. We have our own state Medicaid department, our own state Medicaid director, our own state amendment plan related to Medicaid. So the forms you'll find on our Louisiana Department of Health website. So that certification process will have some federal requirements and some additional state requirements that states are allowed to create on their own.
So the state sends the money to the individual?
Medicaid patients do not receive money. They receive health insurance coverage in the form of their health insurance coverage, but not funding, not money. Yes, sir.
The cut that you're talking about, saying $900 billion if the bill passes, what happens to the people who, what happens to the actual cut if people are getting jobs and able to go to work, and then what happens to those who just can't find a job, then are they put back in the system?
So the simplest answer about, the most simplest answer to that would be if we look at our checkbook. When the money is gone, the money is gone. And so if the state doesn't have the money, you'll have individuals who qualify, who meet the requirements, but the state may just not have the money to be able to provide them with Medicaid. if $900 billion is cut from the federal budget for Medicaid, then those cuts are also going to translate and trickle down to every state in the country. And so states will be forced to be able to make decisions on cutting patients from the Medicaid rolls, and that may actually impact patients who have met all of those qualifications. A lot of these are like the if this happens, that happens scenarios, but when you look at the numbers, we're looking at 200,000+ individuals in our state that, based upon budget numbers, will not be able to have access to Medicaid. Yes, sir. Yes, absolutely. Those Medicaid cuts are going to affect anyone who's on Medicaid. I know that our state has a very robust nursing home system. We have a lot of nursing home in our states. We have a lot of nursing home patients. And when we're looking at budget cuts, we're looking at Medicaid budget cuts across the board. So anyone who is a Medicaid patient could be impacted. Yes, ma'am.
Have you done any kind of studies to try to estimate if this passed in the most extreme form, how it might affect our population?
So tell me a little bit more, because I want to make sure I'm answering your question.
I'm really wondering if people may leave our state because they do not have Medicaid.
Absolutely.
Do you all have any kind of numbers, or have you done any kind of research or anything else?
So we don't have the numbers, and maybe some of my colleagues on the coalition may have those numbers, but we don't have the estimates on the individuals who may leave the state. But we can look at other healthcare access issues, other employment issues, and know that the population of our state has decreased over the past 10 years, and it has been because of our healthcare system as the reason, employment opportunities as the reason, and education opportunities. So if we look at that data, then we can certainly say that that would apply in this situation as well. Thank you all. I appreciate it. I felt like I got taller as the presentation went on.